I'm Dr. Frita, and today I'm giving you the top kidney pain causes and symptoms you should never ignore. I am a board-certified nephrologist, which means I am a kidney disease specialist. So kidney pain is something I deal with in my practice day in and day out. There are so many types of kidney pain, whether it's flank pain or abdominal pain or pain when you urinate. And depending on the kidney pain symptom, it can really be a hint to an underlying kidney disease that you may have. So it's really important to recognize what these kidney pain symptoms mean and what's going on, because if you ignore these symptoms, it could potentially lead to you having a chronic kidney disease or even kidney failure. So whether your pain symptoms mean you have a urinary tract infection or kidney stones, or even kidney cancer or an underlying genetic disease, it's very important to understand the causes of kidney pain. Keep watching. I am offering a concierge telehealth consultation service. So no matter where you are located in the world, you can talk to me, we can have medical conversations, and I can give you personalized information. Just make sure you click the link, you go to my profile, and you can set up your appointment today. I will talk to you and just really take my time and give you world-class health advice. Not just generalized advice, but advice that is personal to you. I'm Dr. Frita. I'm a medical doctor and I'm board certified in nephrology, which is the study of kidney disease and high blood pressure. And today we're going to talk about the top kidney pain causes and symptoms you should never ignore. So yes, in my practice, many patients come to me complaining of kidney pain, and they have various symptoms that really are just huge hints, huge warning signs of underlying kidney disease. And so what I would like to do in this video is to empower you so that if you're having kidney pain or if you're having certain symptoms, you can have a good idea of what's serious, what's not, and when to call your doctor. You definitely don't want to ignore some of these symptoms, because having them and having the underlying cause of the symptoms could lead to kidney failure. Kidney stones or nephrolithiasis can definitely cause kidney pain, okay? I'm telling you right now, kidney stones will make my grown male patients cry and fall to their knees. It's no joke. Now, when you get kidney pain from kidney stones, it can present as flank pain, which is a pain in your lower back, usually under the ribs, but above the hips. And it can be on one side or both. And it's where the love handles are. That's what I'm talking about when I say the flank. It can also cause generalized abdominal pain, meaning more in the front, like where you consider your stomach to be. You could get pain like that from kidney stones. You can also get side pain, which is, pretty self-explanatory. Pain from kidney stones can also radiate, meaning it can start off one place, like in your flank or where your kidneys are, and then it can shoot or radiate or go toward another area, like in the groin. And when it comes to kidney stones, depending on the location, you may have some pain that radiates not only to the groin, but men, it can radiate to the testicle, yes. If you have a kidney stone that's down in the ureter, which is that tube that connects the kidneys to the bladder, then it can radiate to your testicle on the same side. Ladies, it can radiate to your labia or to your lip and the genitalia. The kidney stone pain can be for different reasons. It can be because the kidney stone is actually blocking urine flow, okay? And if it does that, it causes an obstructive uropathy that can cause the kidney to swell and cause a pain for that reason. You can also get something called renal colic, which when the kidney stone moves, the way the kidneys work, we have a peristalsis, meaning we have waves of movement in our kidney system. Well, if the wave causes a tightness around that kidney stone, it can cause you to have a renal colic or a pain that could last for up to 20 minutes, like a 10 out of 10 pain. But then as the peristalsis continues and the tightening loosens up around the stone, then the pain can subside. So you can get a renal colic, or the pain can come from the kidney stone literally scraping the inside of the kidneys. So yes, kidney pain from kidney stones can cause flank pain, abdominal pain, side pain, radiating pain. Be sure to watch my YouTube video on the painful truth about kidney stones after you finish watching this video. Urinary tract infections, or UTIs, are another cause of kidney pain. So urinary tract infections are very common. It's a very common infection, usually by a bacteria, but you can also get fungal urinary tract infections as well. Women get UTIs more often than men do. It's actually a 4-to-1 ratio. Women are 4 times as likely to get UTIs, and this is why. The way that the bacteria will climb up and get into that urinary tract system or get into the urethra and the bladder, well, they have to climb through a tube. And so the way the kidney system works, you have your bladder, and then the tube that connects your bladder to the outside world is called the urethra. Well, with women, the urethra is very short, whereas with men, the urethra has to go from the bladder all the way through their organ, and so it tends to be longer. Because women have a short urethra, it's not very hard for these bacteria to climb their little sticky mean selves up and get into the bladder and cause an infection, a bladder infection or cystitis. So this is the deal with the UTI. So let's talk about some of the pain symptoms associated with UTI. You can get the abdominal pain that we talked about. Oftentimes it's going to be in the lower abdomen if you have a bladder infection or cystitis. You can also get dysuria. And dysuria means that it's painful when you urinate. Dysuria can be a pain symptom associated with UTIs. Another thing you can get is hematuria, or blood in the urine. Yes, a UTI can cause blood in the urine, and it can look bright red, or more often than not, it may look pink or like little spots of blood in the urine. So yes, this can be a symptom associated with the UTI. With UTIs, there's something that is called honeymoon cystitis. So what does that mean? Honeymoon cystitis, or inflammation of the bladder. One way to prevent UTIs, for ladies in particular, is after you have sexual intercourse and when all of that bacteria is just kind of there waiting to crawl up your short little urethra. Well, as soon as you finish having intercourse, it's best if you hop up and you urinate. Yes, you urinate. That way, any of those little bacteria, those little E. coli, those little Klebsiella, any of those bacteria that are trying to climb up your urethra, if you urinate right away, they won't have as great of a chance as getting up there and causing you a UTI. So yeah, they call it honeymoon cystitis because if you're sitting there just enjoying yourself in the afterglow after having intercourse, well, while you're, having your honeymoon, the bacteria can be causing a UTI. Okay, just a little advice. Now, we talked about the bacteria climbing up the urethra and causing a urinary tract infection. Well, if that infection ascends, if they keep climbing up through the ureters, those tubes that can lead up to the kidney, well, then you can get an infection in your kidneys, and you can get kidney infection or pylon nephritis, which is another cause of kidney pain, okay? And the symptoms that you typically get with pylon nephritis, you are going to get that back pain, okay, which quite literally is in your back. It can even be in your upper back, or the flank pain, as we talked about, the pain where your love handles are in your back. You can get side pain. You can get abdominal pain. With pylon nephritis, you can even get sepsis or an overwhelming infection in your body that could even lead to septic shock. And certainly, again, with the pylon nephritis, you can still have the dysuria, you can have the hematuria, you can have the cloudy urine. And another thing with these urinary tract infections, you can get urinary frequency. What does that mean? You have to get up and use the restroom a lot of times. You feel like you are frequently having to run and use the restroom. That's urinary frequency. The other thing you can get is a urinary urgency. It's when you feel like you have to go to the restroom, gotta go right now. But once you get there, you really didn't have to go. So if you're having any of these symptoms, please beware. It could be a sign that you have a urinary tract infection that may have even progressed to a kidney infection or pylon nephritis. Oh, and if you do get that sepsis or that overwhelming infection with UTIs, bladder infection, pylon nephritis, you can definitely get fever and chills as symptoms. PKD, or polycystic kidney disease, another disease that can cause kidney pain. And this is a genetic disease. In fact, PKD is the most common hereditary kidney disease. In our kidneys, we have nephrons, which are the functional units that help us to filter out blood, get rid of excess toxins, get rid of excess fluid, and to help us to maintain our balance. In each kidney, and you're born with 2 kidneys, most people are, in each kidney, we have approximately 1 million nephrons. Well, in these nephrons, in addition to having tiny little blood vessels, and we have a Bowman's capsule, well, we have these ducts, okay, and these tubules. In polycystic kidney disease, you have these cysts, multiple cysts that will form within these tubules. Now, the cysts themselves are benign, okay? They're literally just like fluid-filled bags. But when you get so many cysts, and especially when they start to grow and become numerous, they can actually affect the way that the kidney functions. So these cysts can be anywhere from microscopic in size to multiple centimeters and very large. And the more cysts that you have, well, it can actually start to interfere with the function of your nephrons. And if it does that, it can cause a decline in kidney function. The other thing that these cysts can do is they can cause pain. Okay, you have these multiple cysts and they can make your kidneys very, very large. And if the kidneys get large, they have to expand, right? They have to go somewhere, and they can actually be poking on your other organs, poking on your back, and they can cause certain blockages and obstructions in some cases. And so having polycystic kidney disease can definitely cause pain. In addition to causing kidney pain, PKD can lead to other symptoms as well. So yes, the kidney pain from the cyst being so large, it can also, in some cases, lead to urinary tract infections, or the cysts can become infected, which then can lead to urinary frequency, urinary urgency, hematuria, or the blood in the urine, cloudy, foul-smelling urine, all of those things. If you're having some of these symptoms that could possibly be associated with polycystic kidney disease, be sure to consult with your physician, because fortunately, we actually do now have medicines that can help to slow down the progression of CKD and slow down the progression to end-stage renal disease or needing dialysis or a transplant. Kidney trauma or kidney injury can definitely cause kidney pain. And all kinds of things can lead to kidney trauma. You can have a car accident, blunt force trauma. If you're somebody who's into martial arts, or if you're just in a fight and you get knocked in your kidney, okay, that can cause kidney trauma. And certainly gunshot wounds or stab wounds to the kidney, that's going to be traumatic and can cause kidney pain. The important thing is this: knowing when to go in to see the doctor. A lot of times when you have a car accident and the policeman comes and the fireman comes, they offer you to go to the ER. A lot of times after a car accident, your adrenaline's running, you don't feel any pain, you don't know what happened. But if you are having kidney pain after a car accident or some type of a blunt trauma, you want to make sure that you consult with your physician or go to the ER to make sure that your kidney injury does not need some type of a surgical intervention. Kidney cancer is another potential cause of a kidney pain. Now, typically, kidney cancer is silent in many cases, okay, meaning there are no symptoms. You can be asymptomatic. But kidney pain, in some cases, actually can be a symptom of kidney cancer. It can be flank pain, side pain, back pain. Now, the kidney cancer, renal cell carcinoma, that's the most common cause. And while we don't necessarily have one pinpointed cause of the kidney cancer, with renal cell carcinoma, there are some associated risk factors. For example, if you are a cigarette smoker, you are at a higher risk for kidney cancer. Also, if you're a person who's living with obesity, if you have high blood pressure, that is a risk that could be associated with kidney cancer. Also, if you have a family history, or if you've been on dialysis long term, that's another risk factor for kidney cancer. In addition to kidney pain, some of the other kidney symptoms associated with kidney cancer in some cases include the hematuria or blood in the urine. You can also have hypertension, night sweats, unintentional weight loss. Renal vein thrombosis, okay, another cause of kidney pain. And that is when one or both of the main renal veins that drain the kidneys get blockages. And this typically will happen if someone has a blood clotting disorder, like where their blood gets very thick, where it clots very easily, okay? Or if they have something called nephrotic syndrome, which can lead to a hypercoagulable state or blood that clots. And basically, instead of the blood draining nicely from the kidneys and going to the inferior vena cava and going the way it's supposed to go, you just get a big old clot there, okay, a renal vein thrombosis, and it can definitely cause pain, like a flank pain. It can also cause blood in the urine or hematuria. So just remember, another cause of kidney pain could be renal vein thrombosis, especially if you're someone with a history of a clotting disorder or even lupus that leads you to have a hypercoagulable state, or nephrotic syndrome, minimal change syndrome, someone who's been told you're leaking a lot of protein in your urine. If you have any of these diagnoses and you have kidney pain, just think renal vein thrombosis could be a possibility. Consult with your physician right away. Autoimmune diseases. Certain autoimmune diseases can actually lead to inflammation in the kidneys and cause kidney pain as well. That's kind of a little known fact. So autoimmune diseases are diseases where your body's immune system, instead of just fighting the bacteria, viruses, and the foreign invaders that it's supposed to fight, autoimmune, your body's immune system turns on you and starts fighting you. Like an autobiography is a book about oneself. An autoimmune disease is a disease that fights oneself. Some examples are lupus, IgA nephropathy. So with lupus, you can get something called lupus nephritis, where you get inflammation in the kidneys. And if it happens like acutely or rapidly, or the kidneys swell, yeah, it can cause kidney pain. It can also cause hematuria or foamy urine as well. Also with the IgA nephropathy, that's something else that when you get that glomerulonephritis, that inflammation, it can cause pain on one side or both of the kidneys. It can also be associated with foamy urine or Coca-Cola colored urine, blood in the urine. Certainly, if you're having any of these symptoms, contact your physician immediately. When you have these autoimmune diseases like IgA nephropathy, lupus nephritis, in some cases, they can also cause a swelling of the hands and of the feet. And this is edema. So edema is if you get swelling or fluid in your tissues, like in your hands, your feet, your ankles, your legs. And oftentimes, if you press your fingers down, like on your legs or your feet, it might leave a pit, right? It might leave an imprint of your hand. And in that case, it's pitting edema. Nephrotic syndrome that I mentioned earlier when I said that renal vein thrombosis can be associated with nephrotic syndrome. That's something else that can be associated with edema. And that edema tends to be generalized, like your whole body is swollen. Now, I've covered definitely the top kidney pain causes and the symptoms you should never ignore. But I will say there are some questions that I get asked frequently about kidney pain. One is, can dehydration cause kidney pain? Now, classically, dehydration won't cause kidney pain. However, if you get severely dehydrated, that can increase your risk for kidney stones, which of course can cause kidney pain. It can also increase your risk for renal vein thrombosis, which can cause kidney pain. So that's the link with the dehydration. Another question I get commonly is UTIs, urinary tract infections. Can they cause kidney pain? Yes, definitely. The urinary tract infection, it may start off in the bladder or like cystitis, but if it ascends up to the kidneys causing pylon nephritis, then definitely kidney pain can ensue. Another important question that I get asked frequently is kidney pain versus back pain. How can you differentiate? And honestly, they can be very similar, right? They can both be in that costovertebral angle, kind of right down there below the ribs and your flanks and where the love handles are. And how do you know if it's like a muscle spasm or something that's being caused by a pinched nerve or a herniated disc versus is it your kidney? Well, the main way to know is by checking the urine. If you want to differentiate between the back pain and a urinary tract infection, you should see your doctor and ask for a urinalysis with micro, okay, where they can look for white cells or signs of infection, and also a urine culture to see if there are bacteria growing. If you have a pinched nerve and back pain, like from muscle spasms, that is not going to be the cause of bacteria growing in the urine. So yeah, a urinary sample, a urine culture is how you can differentiate, but definitely consult with your physician. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. Now, I definitely want to empower you so you can have some knowledge of your own body. You can understand how these different kidney pain symptoms can really be a hint of underlying kidney disease. And I'm sharing this with you so that you can be your own advocate and you can go in and feel empowered when you see your doctor. It doesn't mean I want you to sit at home and doctor on yourself. I still want you to consult with your physician if you're having some of these worrisome kidney pain symptoms. I appreciate you for watching. I appreciate you for the support. And as always, I want you to do your best to live your healthiest, happiest lives. I'll see you next time. I'm Dr. Frita.